It is time for Health Monitor once again. My name is Jibe Ologe and thank you so much for finding time to be with us on today's package. We have our health-friendly segment for your health pleasure, assisted conception. Let's take a break and the show will return shortly. It's Health Monitor, number one health service.
Hello, good day. You're welcome to the assisted conception part of the show, and I am Dr. Ivy. So I'm going to be talking about pelvic inflammatory disease today, or PID for short. PID, a lot of us have been hearing about PID. What is PID? PID is an infection of the upper part of the female reproductive system. When I mean upper part, I'm talking about the part that is not seen, the part that is inside the pelvic cavity. And this part includes the ovaries, the fallopian tube, and the uterus. The uterus is also known as the womb. So an infection that affects those parts is what we call PID. And it's usually an ascending infection. When I say ascending infection, meaning it comes from the vagina, then move upwards towards the womb, then the fallopian tube and the ovaries. So what is the cause of pelvic inflammatory disease? What are the causes? What can be done? We're going to talk about the causes, the signs and symptoms, the treatments, the complications, and how to prevent pelvic inflammatory disease. So the commonest cause of pelvic inflammatory disease is poorly treated or untreated sexually transmitted infection, with chlamydia trachomatis and Neisseria gonorrhea being the commonest organism involved. When I talk about gonorrhea, it's the same gonorrhea that affects the male folks. So unlike a man, if a woman has gonorrhea, she may not know. She may or she may not know, but most times she will not know. But if a man has gonorrhea, he's going to have difficulty in urinating. But unlike a woman, that may not be the case. So a woman with sexually transmitted infection may not know, and this she gets it from her partner, and afterwards the infection is not treated. It goes upward to the upper part of the reproductive system, the womb, the fallopian tube, and the ovary. And sometimes the whole of the pelvic cavity is contaminated. So what are the signs and symptoms of pelvic inflammatory disease? In most cases, there may not be any form of sign or symptom, but sometimes the woman may have generalized pelvic pain, that is lower abdominal pain. She may have pain as a severe lower abdominal pain. She may also have vaginal discharge or a new kind of vaginal discharge. And usually this vaginal discharge may have what we call pus, as it could have pus, and it could be very, very, very smelling. Then she may have fever. Her body will be hot, temperature will be very high. You have irregular menses, pain during sexual intercourse, severe pain during sexual intercourse. She may also have pain or burning sensation when she's passing urine. This could all be signs of pelvic inflammatory disease. Then how do we diagnose pelvic inflammatory disease? How is it diagnosed in the clinic? A woman who has these symptoms should please try and visit a gynecologist or her doctor. Once she gets there, the doctor is going to elicit some signs to know that, okay, this woman has PID. And then there are also some tests which may be carried out to know that a woman has PID, like the vaginal swab. The discharge, like I said, the discharge could be having pus, and this pus will be foul smelling as well. So once the discharge is collected on the swab, it's going to show that those features of being foul smelling and then containing pus. Then also, there are some other tests like ultrasound scan, which may be done by which may be done and may show some sign of pelvic inflammatory disease. Then there's also what we call laparoscopy. Laparoscopy means direct visualization of the pelvic cavity, and in this way, the doctor is a high-tech test in which a small hole is made on the woman's abdomen, and then a camera is taken into the abdominal cavity. After doing all these tests, how do you treat this pelvic inflammatory disease? PID is something that should be taken seriously. Once a woman has pelvic inflammatory disease, it's not the kind of infection that your doctor will give you antibiotics and then you will stop halfway. No. A woman has to have the complete course of antibiotics. And then after being treated with antibiotics, she should also go for regular checkups from time to time. And these are things that if there's pus in the cavity, the pus can also there can be also pus in other parts of the pelvic cavity which can be evacuated. Then what are the complications of pelvic inflammatory disease, which is very, very important? Whether it has been treated or not treated, complications can arise from PID. And one of the commonest complications is tubal blockage. And that's because of what we call adhesions. Once the body has undergone that kind of infectious process, the human body, by default, tries to heal. And once it's trying to heal, there's what we call scar formation. Just like when you cut yourself, you're going to heal by scar. And the scar is not going to be the same architecture with the normal skin. That same process happens in the pelvic cavity. The scar now is called adhesions. This form of adhesions goes to block. It now blocks the fallopian tube, and the woman may come down with tubal blockage after a long time. So the infection may have been cleared, but the possibility of her having tubal blockage is very, very high following PID, whether treated or untreated. But if a woman who has PID, which was detected early enough, then she had a complete course of treatment, then this complication may not arise. But if the PID was detected late, even after treatment, she will likely come down with tubal blockage. And we know that the role of the fallopian tube when it comes to pregnancy cannot be overemphasized. A woman who has tubal blockage is going to come down with infertility because she is not going to be able to get pregnant, because after she ovulates, normally a woman ovulates, release the eggs from the ovary. The egg is supposed to pass through the fallopian tube, but once there's a blockage in the fallopian tube, there's no way the egg is going to pass through the tube anymore. So the egg and the sperm cannot meet once the tubes are blocked. I've talked about tubal blockage in some of our sessions, but now the egg and the sperm cannot meet. There will be no fertilization and there will be no pregnancy. So tubal blockage is a common complication following pelvic inflammatory disease. Then we also have, if the tube is partially blocked, the woman may come down with what we call ectopic pregnancy. And this is a life-threatening complication for the woman. So it's a very big problem when it comes to that. So when you have ectopic pregnancy, it could have been as a result of previous pelvic inflammatory disease. So how do we manage this complication? Because the most important thing to us in our society is the infertility part of pelvic inflammatory disease. A woman who has had tubal blockage is not going to be able to get pregnant naturally. She has to go through in vitro fertilization, which is the assisted conception we always talk about. So you see, whenever I talk about assisted conception, it's a very beautiful aspect of medicine because it has brought smiles to a lot of homes in Nigeria, a lot of homes in Africa, because we marry because we want to have children in this part of the world. So once a woman has had PID, tubal blockage resulting from the PID, it's not a case of she cannot be pregnant. No, she can be pregnant because her womb is still intact. She has her womb and she has her ovaries. So with in vitro fertilization, with IVF, we don't need the fallopian tubes. All we have to just do is go straight to her ovary, grow some of her eggs, bring out these eggs, use her husband's sperm to fertilize the egg, and then put back these embryos in her womb. She gets pregnant. So whether a woman who has had PID or who has tuber blockage, with in vitro fertilization, she can always be able to get pregnant. And like I always encourage all the women out there struggling with this challenge, should please come forward, and then and we can help you. And the earlier you present, the better. And I encourage you to also spread the word to your family, friends, and people around you. Let them know that there's a solution for infertility. Thank you very much for listening.
That was Health Monitor for you again today. I want to appreciate you for your time with us. Please get us your feedback. The social media handles on the screen. Send us messages. Let us know how the program has actually benefited you. Okay, this will definitely spur us to do more research and bring more health information to you. I'm Jibe Ologe, and I want to catch you again on Health Monitor, your guide to good health.
Time again for Health Monitor, the #1 program that's all to have to live a life that is healthiest way. To improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day.